Hello and welcome to Primary Care Today on ReachMD. I'm your host, Dr. Brian McDonough, and with me today is a special guest, Donovan Green. He is a motivational speaker, celebrity fitness trainer, and he has a new book, No Excuses Fitness, the 30-day plan to tone your body and supercharge your health. And Donovan and I were talking a little bit before the program that we have a physician audience, and we're going to be talking a little bit about how we have frustrations not only in our own lives, I know I do, but also with the patients we deal with, talking about fitness and trying to get them to buy into some of the things we talk about. And obviously, you're someone, not only a celebrity fitness trainer, but you also have had projects such as Project Slim Down, and you've written books, and you've talked a lot about working out and getting people excited. So my first question for you is, for those of us who are working with patients and more or less delivering that message to get in better shape, what are some of the tips you use, the things that you say to motivate people?
Some of the tips that I use first of all, it's great to be here in the radio show. Thank you for having me.
Oh, it's great to have you.
You know, when you think about exercise, people tend to shy away from exercise because they assume it's going to be difficult. They assume they have to get on a treadmill, they have to run, they have to do burpees. And I tell them, all I want you to do is move. Simply move. You start off slow. You start walking. If you're sitting in front of the computer every day, get up every 30 minutes, do a couple of stretches, reaching up to the ceiling, reaching down, touching your toes, just allowing your bodies to get used to moving. That's it, keeping it very simple.
And when you talk about that, I think it makes a lot of sense because I know, we might get our patients motivated and all excited about exercising, but the bottom line is when they leave, it's a day or two later. If it's something that's difficult, they're not going to go back to that no pain, no gain philosophy in high school. They don't really want to experience pain. They want to experience something they enjoy. And I think starting slow is a great way to recommend them to get going.
Yeah, it's something that's doable. My thing is, when you speak to adults, it's like speaking to a child. You tell a kid no to something all the time, that kid is going to want to do it. And if you tell an adult, you have to, they're going to rebel by not doing it. But when you add their health to the equation and you let them understand what walking 30 minutes a day can do for you, how it can reduce your chances of catching a stroke, or how it can help you to increase your blood circulation, which will in turn strengthen your heart, they begin to associate that to their health and just their longevity.
Now, when you're dealing with your clients and you're trying to get them to exercise, obviously you have celebrity clients. And I always hear people say, well, these celebrities, they have plenty of time to exercise, but doing enough interviews as I do, I get the chance to meet a lot of celebrities. They pretty much have really packed schedules. It's not as easy as many people would think. They travel a lot. If they're actors or whatever, they're working all day at their craft. So how do you get someone with a limited amount of time to be motivated to get that exercise in and to do those things and keep up with it?
It's funny. One of the things in my book, in No Excuses Fitness, is I help people to say, look, if you can't give me a lot of time, if you cannot give me 20 minutes, give me 2 minutes, give me a minute, give me something, because something is better than nothing. And that's the mentality. Something is better than nothing. Just move. And I can say that a million times. Just move.
Now, you are the founder of what's called Project Slim Down. Tell me a little about that. What is that?
So Project Slim Down is a website that's based with 20-minute workouts or less. I'm teaching people how to work with their own body weight if they don't have equipment. I'm also teaching people how to use equipment if they do have equipment. And the good thing about this is you can do everything at home in your living room, just like what I talk about in No Excuses Fitness. Your living room is free. So we're taking away people's excuse to say, I can't get to a gym. Well, if you can't get to a gym, guess what? We have these fantastic programs just for you, and no matter what level you're on. If you're a beginner, if you're somebody who have injuries, if you're somebody who was an ex-athlete, we have things for you.
What are the toughest people you deal with? Who are the ones that you get the most resistance? Is there a personality type? Is there a certain type of individual who frustrates you?
I don't get frustrated. With me, I don't get frustrated at all. For me, it's just about understanding a person's life and what they love. So I guess I'm fortunate enough to have clients who I just adapt to everyone. So they learn how to embrace their own bodies. So you would think somebody who was a weightlifter would be, I know everything, I don't need any help. Those are the ones who will show a little resistance, but once I talk with them, they begin to understand why it's important to stretch more. Or somebody who is into a lot of cardio, they understand why it's important to lift more weights. So I always find a balance with clients.
If you're just tuning in, you're listening to Primary Care Today on ReachMD. I'm Dr. Brian McDonough, your host, and I'm speaking with Donovan Green. He is the author of No Excuses Fitness, the 30-day plan to tone your body and supercharge your health. Got to ask you about that. I mean, when we talk with patients, we look at lifelong episodes and how to do things. But the idea of a 30-day plan, tell me a little bit about it.
Well, the idea of a 30-day plan, it's not 60 days, it's 30 days. It's something that is doable. It's only 4 weeks. And the idea is we have a REACH program, which is basically workouts done from the chair for people who have knee problems, back issues, problems in the hips. And we're showing people you can do a ton of different movements just from sitting down. That's where most of us are anyway. So I'm going to meet you where you are and just show you how to get strong there. And then we transition from that area and go into the think phase, which is now where it's, now you're moving and you're getting stronger, and now you're able to get out the chair. Then we're going to the move phase where you're totally out the chair and you're using your chair as the equipment of strength. So we're giving people all these different variables and meeting them right where they are. A lot of the routines can be done even if you're in a wheelchair. So we're taking away the excuses. I'm taking away people's excuse when they say they don't have time or they're injured or they can't afford a gym membership. With the 30-day recharge program, I'm not only showing you just exercise, you're also getting nutritional guidance, and you're also getting mental and spiritual programs, too, for 30 full days.
You mentioned the idea of people sitting down a lot, and clearly I think most people now, or many people at least, in their jobs, they're working at computers, they're working at a desk, and recently some studies have just come out talking about the more sedentary you are and the more you sit, you have greater risk for heart disease and other issues. So it probably is important to get people things they can do during the day, especially if they're locked in more or less to a job where they are sitting.
Oh, absolutely. It's so much more important to do that. I mean, I have clients who work in corporate America, and I tell them simply get up, because every time you sit down, you're shortening your life. Dr. Oz is a great friend of mine, and, he does heart surgery. And, no offense to Dr. Oz, I don't want him to make money from doing no more heart surgery from people who could have easily, changed that reality by just starting to exercise a little bit more. Not a lot more, just a little bit more, and starting to avoid the sedentary type of lifestyle.
Now, again, you deal with celebrities, you deal with people, Hollywood actors, actresses, also politicians. What about the political life and the politicians you've dealt with? A lot of pressure for them?
Lots of pressure for them as well. Lots of pressure for them as well. They're constantly in Albany, constantly. I mean, they sometimes will spend weeks away from their families. And the foods that they get there are horrible. They're not getting the healthiest things. And then they're dealing with a lot of stress. They're dealing with writing bills and, going to seminars and workshops and talking about 24/7 every single day. So the stress levels are extremely high. They tend to not exercise. They tend to not do anything that's really healthy for their bodies, their mind, or their spirit. So what I tell them is you will succeed at a greater rate if you start to just adapt a healthier lifestyle. So with No Excuses Fitness, the idea here is to show people that you can do this no matter what your lifestyle may be. You could be someone who is a politician, a celebrity, a physician. You could be somebody who is a bus driver, an at-home mom, anybody. There's a program in this book for you. And it's just about getting America to wake up. Wake up.
What do you see as physicians doing wrong? Like you come in, obviously you see a physician for an exam or whatever, you've talked with them. What are we doing right and what are we doing wrong in helping our patients? Because clearly, as a society, we do have an obesity epidemic and we've got a lot of issues. Are there things you would like doctors to do better?
Yes, there is one specific thing. And the one thing is anytime a doctor uses a stethoscope to put on my chest, for example, when they tell me to take a deep breath in, I used to breathe incorrectly by breathing from my chest and not from my diaphragm. And it's important for doctors to know also that, where our lungs are located, when we take our deep breaths in, we want to expand our stomach. And a lot of people don't know that, so they tend to be chest breathers. When you look at a baby breathing, they're breathing from their stomach. We're filling that air up, and then we release the air as we breathe out. A lot of my clients don't know how to breathe properly. And as a martial artist myself, I've been studying the arts since I was 13 years old. I learned that breathing from our diaphragm versus the chest is a so much better for circulation in our bodies.
That's a good point. You actually make a lot of sense, and you're right with that. What about your own life? What took you down this path? Why did you decide you were going to do this?
It's a beautiful thing. Well, coming from Jamaica, I was a chubby kid, grew up in the Bronx in New York, and I used to watch people in my church just eat whatever they wanted, and they were talking a lot about the Holy Spirit and, the body being the kingdom, and it just didn't click to me, like, how is my body my kingdom, and we're just doing so much stuff to it? What's going on here? And I started exercising through my uncle, Duncan, and he started showing me about weight training and got me to running and martial arts, and I began to love the feeling of exercise. And from that point, just being able to sweat and get my heart rate up and just feel like I accomplished something, I just fell in love with the whole aspect of fitness.
I have a question for you. I used to play tennis all the time, played high school, college, and then I was making money. I would teach tennis. It ruined my tennis game. I didn't want to play tennis because I was teaching tennis, and frankly, the last thing I wanted to do was play more tennis when I had free time. I got to ask you, as someone who works with people all day, and you're helping them exercise, how do you stay in shape? How do you motivate yourself to keep going?
You know why? My body is my moneymaker. My health is my moneymaker, so that's more than enough incentive for me to stay in shape. I never want to be that trainer with a big gut and the trainer that drinks alcohol or the trainer that smokes a cigarette. I never want to be that person, so my inspiration comes from my lifestyle. I believe very much in what you practice is what you preach, and you should always just do what you say, lead by example. So when I'm training my clients, I will show them things and I'll teach them how to, proper form. But for me, I always set time aside for myself. If I do a 20-minute workout or hour workout, if I could only do 5 minutes, I'm doing it at the most intense level that I can possibly do it at to maintain my physical stature.
A lot of sense for physicians as well, because if we're going to be sending messages to people, we have to at least look like we're attempting to lead that lifestyle and be as healthy as possible.
Oh, great point. Great point. I have a lot of friends who are physicians, and I tell them, you can't tell a person they're overweight if you're overweight. That doesn't look right. You have to start taking charge of yourself as well. You have to set the example. They always say, Donovan, you're 100% correct. And I see them a month later, and they're probably 5 more pounds heavier.
So they agree that you're right, but they still haven't made that turn. If you had to give, and I pick a number 3, but you can make it 5 or 2, 3 things that people should do to try to make those changes in their life, things that doctors could tell their patients and say, listen, start with this, this, and this. What would 3 things be so they don't come back, a month later and they're 5 pounds heavier?
That's a good question. The first thing would be to cut out the simple sugars out of your diet. The simple sugars is just destructive to your brain, destructive to all the cells in your body. Cancer loves those things. It's like you eat all these processed foods. Cut that stuff out or cut it down, right? The second thing would be to start to exercise much more. Start to work on your cardiovascular system or your musculoskeletal system, which means your muscles and your skeletons, and also your nerves. Work on all of those things. And the third thing is to learn how to eliminate stress out of your life, whether it's a person, a place, or a thing. Just learn how to eliminate those things out of your life.
There are 3 great points, and you're right. I think if we just did those 3, it isn't that technical, but it's very hard to do, but it also, at the same time, would lead you down a much more positive path in your overall health. And again, there are things that you can do. I agree with you on all points, but I also am always telling my patients about the sugars and the processed foods and a lot of the things that, if it could stay in your shelf in your house for a long time without it being refrigerated, well, then it's probably not good for you.
Yeah, for real. I agree with you 100%.
Donovan, we only have about a minute or so left. I wanted to ask you, we talked about a lot of stuff. Is there something you wanted to bring up that you thought was an important point that you'd like to share?
Yeah, I mean, the thing I would like to bring up for anyone who's listening when it comes to exercise, whether it's a physician or a patient, is your life really is your life, and whatever you do with your life will dictate your life. So at the end of the day, what am I saying? Your life is what you make it. If you make your life a healthy lifestyle, then you're going to be a much more healthier person. If you surround yourself around the unhealthy things, then you will be unhealthy. And that's the most simplest way that I can put this fitness thing, because it's so confusing for everyone now. What is right, what is wrong. Just live your life and live your life as clean as you can possibly live it.
Donovan Green, author of No Excuses Fitness, the 30-day plan to tone your body and supercharge your health. I want to thank you so much for joining us on Primary Care today.
Awesome, and it was great to be here. Thank you so much.
This is Dr. Brian McDonough. If you missed any or part of this discussion, please visit reachmd.com/primary care today. You can download the podcast. You can learn more on this series. You can check out the website and find out how to grab the show. I want to thank you so much for listening.